Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast. We have a great podcast coming for you today. We're going to be talking about crisis and emotional health hotlines, both the traditional and the future. We have two great guests with us today, and I'm happy to have my co-host with me here today as well, Daniel Miller, who is the Executive Director of Humans Helping Humans. Daniel, hello.
Hello. Thanks for having me, Carrie.
Great. And today we have two great guests with us. We have Jordan Lichay, who's the co-founder and chair of Minds Ahead, a group of next generation philanthropists and leaders who support the mission of vibrant emotional health. We also have with us today Dr. Anitha Iyer, who is a New York State licensed clinical psychologist. She is also the chief clinical officer and VP of crisis and behavioral technologies for Vibrant Emotional Health. She provides clinical leadership, best practices, and management oversight to Vibrant Services. She's also recognized as an innovator in technology and delivering crisis services and advisor to the National Suicide Prevention Hotlines. Ladies, welcome to the show.
Thank you so much, Carrie. Thanks for having us.
Well, great. We always love to start a little bit with somewhat of a backstory. And Vibrant is doing really great things, has a host umbrella of different crisis services, and you guys are really doing some great things in behavioral health. Can you tell everybody, Dr. Iyer, just a little bit about the different wealth of services and organizations under the Vibrant umbrella and the demographics that they serve?
Sure. It would be my pleasure to, and thank you for having us here to give us a chance to talk about the work that we're doing at Vibrant. So Vibrant is a nonprofit organization. It is based in New York City, but we have really through our programs local as well as national reach. We really focus on empowering individuals and families to achieve emotional well-being, and really focus on groundbreaking solutions, sort of things that are off the beaten path, if you will, very innovative programming that delivers high quality services and support, with an emphasis on getting people to be able to get the care they need when, where, and how they want it and how they need it. And we also have an advocacy and education arm to our organization, where we focus on shifting policy and public opinion such that mental health and mental well-being really becomes a social priority, and is seen as an every person's responsibility. And we have, you mentioned earlier, the National Suicide Prevention Lifeline, as well as a suite of other hotlines that we operate out of our own contact center. And we administer the National Suicide Prevention Lifeline across centers around the country. So it's really a source of pride for me to be able to be part of the team at Vibrant.
Wow, that's awesome. And such amazing things that everyone at Vibrant's doing over there. And Jordan, I want to talk a little bit. You're the co-founder of Minds Ahead, and you're also the Youth Council Chair for Vibrant. Tell everybody why it was important for Vibrant to really form a youth council and really understand the youth, the Gen Zs, the millennial perspective, and how to really relate and spread more awareness of behavioral health and the technology and social impacts it has on our youth.
Yeah, sure. You use the term kind of relate, and I think that's key. It's all in relatability. Recognizing obviously that mental health challenges don't discriminate among age and the many other demographics, for example. But, the leadership at Vibrant was and is so forward thinking in that they wanted to ensure that the generations to come are not only building awareness for the many support programs that Vibrant offers and the others that exist, but are really continuing to make progress against that stigma, the stigma tied to mental health and wellness, and the ways to get involved from a philanthropic standpoint
when you look at the stigma over the years, so much progress has been made. I look at my peers who are so brave and open about their personal struggles, as opposed to, for example, my parents' generation, even with the ways that they cope. But we also recognize how much work there is still to be done. So with Minds Ahead, we have definitely created or tried to an environment where that peer-to-peer advocates can very easily relate to millennials, especially at Vibrant's Adolescent Skills Center, because we are them.
No, that's really fantastic and really well done, Jordan, on really focusing, on the youth and youth mental health, that humans helping humans. That's one of our primary focuses as well. And so we're definitely laser focused on that.
Yeah, the work we do is so critical. So awesome.
Yeah. And Dr. Iyer, this next question is for you. And it's about Braveline, which was launched in 2011. Just some background that we've gleaned from the website. It's a crisis service for anti-bullying in New York City public schools. So this was kind of really early on, before at least I started hearing a lot about school bullying and that sort of thing. So you were almost, definitely taking the lead there in the industry with Braveline. Can you tell us a bit about why Braveline was started and insights into what you're seeing today from some of the chats and some of the calls, any trends that you might be able to tell us about?
Sure, yeah. You rightly note that the Braveline predates a lot of the other sort of innovative programming that leverage technology to deliver behavioral health care. And it really is telling. The Braveline was developed by the United Federation of Teachers, also known to many as the Teachers Union. And it was really developed in conjunction with Vibrant. And we delivered, at the time, a phone, text, and chat-based service. And still continues, is alive and well, and continues to receive phone calls, text messages, and chats from not just kids, but also from parents as well as teachers or guidance counselors. And the aim of the Braveline really is very focused on bullying prevention and the understanding that bullying is sort of this insidious issue that has been growing in our school systems, and kids and their families and teachers and counselors need answers and support through the process of sort of coping and emerging healthy through the school years. And it has been a pioneering program, and many others have followed suit since then, including a very large text and chat-based program that Vibrant currently also operates, called NYC Well, which serves all of the city and also receives contacts through text and chat, in particular from young kids and parents.
So how have you seen that change over the years with the social media, right? So we talk a lot in mental health about, the depression and anxiety associated with this best foot forward on the social media standpoint. And, it used to be bullying in school, and now we're talking about cyberbullying. How have you seen that increase? And what have you seen from the social media standpoint through either of those crisis services?
Yeah, I think, this is a complex issue, right? I mean, social media can be a very powerful tool in connecting kids with each other and bringing them supports, or connecting kids with resources, right? I mean, it's ironic, right, that we're talking about chat-based programs that are offering kids support, which a lot of times kids are accessing programs like ours, like our web chat programs, through their phones. Right. So there is value in utilizing social media as a force multiplier or as a safe space for kids. However, right, it can also, invite or allow for unwanted or unhealthy influences for kids, including, as you mentioned, cyberbullying. So I think what many of the efforts that we have been placing through our social media work, but also through sort of making technology-enabled services available, is to really leverage technology to amplify the sources of support for kids and their families. Really with the understanding that this is the space that kids are in. So if we want them to reach support, we have to go to where they are. And that in this day and age is technology driven.
Yeah, that's such a great point when you talk about going to where they are. And that varies a lot by demographics and which generation they are from that standpoint. As we look at millennials, which we used to focus a lot on, as they were a technology demographic that grew up on technology, very heavy into texting. We saw a lot of the crisis hotlines start, going from phone only to then doing text and instant messaging, things of that nature. Then we look at the Gen Z demographic who, grew up when started to grow up and get their first phone when FaceTime kind of came out. And so they're a video first calling demographic. And we don't know what the next generation is going to be, but how are you guys at Vibrant really looking at those communication preferences and allowing folks to communicate, to your point, where they at, but how they want to communicate from a technology and innovation standpoint? Dr. Iyer?
Hi. So technology, as I mentioned, it can be really a powerful tool, and leveraging it and really focusing the messaging in the spaces where kids and their families are is really important. And that's really how we have been, focusing our efforts. I can tell you also that when kids reach out through a technology-driven medium like chat or like text, we want to we put a lot of effort into ensuring that the conversation is as smooth as they would experience it if they were speaking to somebody face to face. So we really put a lot of emphasis into, you mentioned sort of video chatting and sort of going into the next generation. We really ensure that the conversation that they have reached out for and that they are in the midst of feels as real to them as possible, including sort of providing coaching to our counselors, and all of Vibrant staff are trained mental health professionals, really emphasize sort of the how-tos of communication using text and chat to really make sure that the kids, once they reach out, are supported in the ways that feel very consistent and very genuine to them.
Great. That makes total sense. And I have a follow-up question to that as we talk about the rise in youth suicide rates and just the increased awareness of mental health that we're all working towards and making great strides, but it's not, I don't think any of us are satisfied with the end game right now, but we're educating what is mental health, and mental health is health. And there's a lot of conversations of should schools be having these conversations with the youth? Should parents be having these conversations with the youth? You guys work with a lot of school systems and so forth. Where do you see, parents having these conversations, schools having these conversations to raise awareness? Should both be having the conversations? Where, I know you guys do a lot of legislative things from that perspective, but what are your kind of tips and thoughts there?
This is such a great question, and I'm really glad you're asking it. Because it really emphasizes sort of whose responsibility is this? Whose responsibility is this conversation, especially when we as a society and sort of its people and its advocates are noting that there is a rise in youth suicide rates, right? And that is all of our responsibilities, whether we are in that moment categorizing ourselves as professionals, as teachers, as family, as parents, and knowledge about what mental health is and how one can get to sort of a desired state of health is important for families and schools really everyone to be having with children and together insofar as it is appropriate. Like in many other areas, the partnership between children and families and schools is really the key to success. And mental health is no different. Suicidality conversations are no different, right? So school-based mental health initiatives, which are offered in partnership, for example, between the Departments of Education and the Departments of Health, so as is the case in New York City, for example, are really important in making collaborative conversations a systemic endeavor, if you will, rather than having it be a case-by-case example where a family needs the conversation to happen, and so they are having it and figuring it out, sort of piecemealing it one at a time. And so systemic structures where schools and families know that there's a child in need, we need to speak to them together and really provide a collaborative support and safety net. And also not wait for a crisis to happen, but really make programming about mental health part of the school's routine conversations. So kids start to understand that this is commonplace and it's okay for me to be feeling out of sorts some days. And here's what I can do to support myself and to get help. And that will only help kids learn how to help themselves and to seek support and maybe even to seek support for a friend or classmates. And on the note of suicide, right, that conversation really can then extend to conveying the really important message around suicide for kids, which is that suicide is preventable. And the only way that kids will know that suicide is preventable is if they are speaking about it and they know how to seek out support.
That's wonderful. And Dr. Iyer, what I really like about what you guys are doing is, you're shifting opinions in a lot of different places. You're shifting opinions from the different laws that we have in place, regulations, that sort of thing, but then shifting opinions as well when it comes to it being okay to ask for help for mental health issues. So that's one thing that I really admire about what you guys are doing. Jordan, this next question is for you. It's the same question, but focusing kind of what your thoughts are on where the conversation should be for millennials. Millennials are now approaching, some of them, like yours truly, are quickly approaching 40. So it's kind of, and then, go all the way down into the 20s. So where should the conversation be for millennials who might not be in school, might have graduated already, and are working, that sort of thing?
Yeah, so I couldn't agree more, with Dr. Iyer. It's everyone's and everybody's responsibility. Millennials and college students particularly, we have such fluid lives. You mentioned even millennials are obviously in the workforce. And so it's not compartmentalized. If we really adopt this mindset that we're all responsible, that looking out for one another's emotional health and wellness is part of being human. It's part of being a friend, a teacher, a parent, a celebrity, even. I think we'll see a much larger impact on the mental health community. And, just as importantly, I think this also goes for education. Now we're seeing, in the workforce, people encouraging, mental health days, mental health education, meditation programs, and all of these things are really enforcing the idea that mental health and wellness is a critical component of living a healthy life. And I think the more we influence and the more we embrace that mindset, the better off and more prepared we will be in really tackling these types of challenges.
No, those are great points. And I think, there's just as much as we're educating schools, we need to be educating employers. And I think, having conversations like we do about mental health on a daily basis, which I'm sure you guys do too, is, mental health is health. And if you're an employer who's never had a mental health issue, you may not be as self-aware as an employer that has had a mental health issue in the past. And so I think, the more awareness that we can get will, add value to that from that perspective. So we've talked about, some of the crisis and technology that's kind of being done today. And there's been a lot of really great nonprofits that we've had on the previous shows, as well as mental health professionals, where there's a lot of value in augmentation of crisis lines or traditional therapy with peer-to-peer support. And peer-to-peer support as being a kind of a front line to some of the crisis hotlines or ways to reach out. When we look at the Gen Z demographic and even some millennials, they're really a storytelling generation of, if you have a conversation, say, oh, I had a mental health issue too before, and this is how I got beyond it, or I have this great therapist, or those conversations, they're more adapt to have those conversations and being those silent seekers that never seek help. So what are you, Dr. Iyer, maybe you could tell us a little bit of what your thoughts around peer-to-peer support. Are you guys doing anything in that area today, or where you see that in the future?
Yeah, absolutely. Vibrant has for, several years now been one of the leaders in providing peer support driven services. And I mentioned, earlier on, I mentioned sort of really an emphasis on innovative programming, and that really goes beyond our technology program. So we operate family resource centers where the care navigation services, if you will, are being provided by individuals who have been parents of, children or youth in their homes whom they have helped navigate through their mental health needs. And they are now putting that experience in the service of other parents who are in the same boat. And similarly, we have adolescent skills centers where, kids who are at risk are receiving support and care navigation supports through youth advocates, individuals who have been through their own recovery and have emerged stronger and with the desire to sort of pay it forward, if you will. And similarly, sort of our hotline-based services, such as NYC Well, which I mentioned earlier, incorporate peer support very much as an integral part of the service, leaving the choice of whether one speaks to a mental health professional or to a peer support specialist entirely in the hands of the person who's reaching out. And we really put that at the out front, sort of at the very top of the greeting or the introduction into the call. And allow people to choose if they'd like to speak to somebody who has their own lived experience with mental health or substance use. And we find that it is entirely consistent with the way that people want to receive services. As you mentioned, there's a tremendous amount of power in speaking to someone who's been in your shoes and hearing from them and hearing their story and understanding what it is that they did that turned things around. And we are proud to be able to extend that into our services.
That's great. And are you seeing any trends by having that option up front of wanting to talk to a peer specialist or an actual mental health professional? Have you seen any trends over time, or are you seeing a higher percentage of one or the other at this point?
It's a great question. We have on NYC Well, we have operated our peer support services through phone, text, and chat for over 2.5 years, so almost going on 3 years now. And we have seen a consistent increase in the proportion of people that are reaching out and choosing to speak with an individual who has lived experience with mental health or substance use. And as we're tracking those trends, we're also really proud to be able to then welcome more peer support specialists into the workforce with the aim of sort of really allowing this movement to amplify over time.
That's great. And Jordan, talking about, Minds Ahead and the group of next generation philanthropists, which, want to pay things forward and want to really help out. How do you see more organizations and philanthropists and so forth getting involved in peer-to-peer support to be able to share their story, to be able to help others and really feel like they're contributing to what I'm going to call the, mental health and youth suicide kind of crisis. How do you see that in the future?
I see it hugely critical to the success of any program. As you mentioned before, sharing stories, relating to one another on that really humanistic, vulnerable level, nothing can replace it, and so with that, I say I definitely see it playing a part, but of course within reason. With Minds Ahead, for example, we built a group who all have their own stories to tell and who are willing to provide that peer-to-peer support with others who are maybe going through something very similar. And there's tremendous value in that. We've seen incredible success with the youth from the adolescent skills centers. For example, individuals who, never really entertained the idea of going on to graduate certain programs or go into further education, and now who are succeeding and thriving with that. That said, we are by no means trained professionals. And I think having many colleagues and friends who are, there's so much work and preparedness that goes into something like that. So do I think that, that professional setting can be replaced?
Right.
No, but I certainly think that peer-to-peer is going to be the key to success, in combination with, if you will.
Right. And so that's kind of breaking down some of the walls of the stigma in the culture barriers, kind of as I see it, as peer is a great augment to kind of break down some of those walls to let folks know that it's okay, because it may not be acceptable in their family or their culture or whatever it may be. Break down some of those walls and kind of do that soft introduction to some of the mental health professionals. And not everybody needs a mental health professional, but kind of that awareness is kind of where we see the future headed from our standpoint of a lot of the folks that that we've talked to. Well, great, ladies. Ladies and Daniel, I want to thank you all for being on the show. Click the links in the podcast notes to learn more and really follow Vibrant's story. They have a lot of great organizations under their umbrella and doing some amazing work. Go to vibrant.org to learn more about Vibrant. Humans Helping Humans. Daniel, thank you for joining. And follow Humans Helping Humans and all the great work they're doing on the nonprofit side in mental health as well as addiction at helpinghumans.care. Jordan, Dr. Iyer, Daniel, thank you so much. We really appreciate everybody's hard work and raising awareness on mental health, and everybody keep up to such great work.
Thank you.
Thanks for having us, Carrie.
Thank you so much for raising awareness on this topic. Thank you.
Great.
This podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.